Today's discussion tackles the most widely believed myths about heart health and separates fact from fiction so that listeners everywhere can make informed decisions about protecting their hearts. And before diving into specifics, it's important to understand that heart disease affects millions and misinformation can lead to delayed care, poor lifestyle choices, and unnecessary fear. One of the biggest misconceptions is that only people with obvious symptoms or older adults develop heart problems, when in reality heart disease can develop silently over years, and young people with risk factors such as diabetes, high blood pressure, smoking, obesity, and stress are vulnerable too. So the idea that I'm too young to worry about my heart is simply not true and can lead to missed opportunities for prevention. Another common myth is that heart attacks always present dramatic chest pain. Many people, especially women, the elderly, and diabetics, experience subtler symptoms such as shortness of breath, fatigue, nausea, back or jaw discomfort, and dismissing these as non-cardiac can be dangerous, underscoring how challenging it can be to recognize true warning signs. Next, the role of diet is often misunderstood, with myths such as all fats are bad or only red meat raises cholesterol. In truth, the body needs healthy fats from sources like olive oil, nuts, seeds, and oily fish, while trans fats and highly processed foods are most harmful, and saturated fats should be moderated rather than eliminated entirely. Another myth claims that eating eggs or cheese automatically leads to clogged arteries, but cholesterol from food has a modest effect on blood cholesterol for most people compared to factors like genetics, overall diet pattern, and physical activity. So individuals shouldn't fear nutritious foods without considering context. Speaking of food myths, many believe that salt must be eliminated entirely, but rather the focus should be on reducing excessive salt and processed food consumption while maintaining necessary electrolytes, especially for people on certain medications, underlining the importance of personalized dietary advice. A widely held belief is that exercise has to be intense to benefit the heart. In fact, moderate activities like brisk walking, cycling, and swimming have strong evidence supporting improved cardiac health and blood pressure reduction, and the old no pain, no gain mentality is not only unnecessary but potentially harmful for heart patients returning to activity after surgery or diagnosis. Many think heart medications are optional once they feel better, but discontinuing prescribed therapy such as blood pressure medicine, statins, or antiplatelets without medical guidance dramatically increases risk of complications including heart attack, stroke, and worsening heart failure, because these agents manage underlying disease processes, not merely symptoms. There's also a belief that cholesterol is entirely bad, when truthfully we have good HDL cholesterol that helps remove cholesterol from arteries, and the goal is a balanced profile rather than eliminating cholesterol completely. Another myth is that stress doesn't impact the heart. Chronic stress triggers hormonal responses that increase blood pressure and inflammation and directly contributes to plaque formation and arrhythmias. So effective stress management is as essential as diet and exercise. Many assume that losing weight quickly after diagnosis or surgery is healthy, but rapid weight loss often leads to muscle loss, nutrient deficiency, and metabolic stress, whereas gradual, sustainable lifestyle changes support long-term heart health. There's a misconception that supplements alone can protect the heart, but unregulated supplements offer inconsistent benefits and may interact with medications. Whole food nutrition remains the foundation of cardiovascular protection. Some people also believe that once they have heart surgery, they are permanently fixed and no longer need to pay attention to lifestyle, but surgery corrects structure, not the underlying disease processes. So dietary management, regular exercise, medication adherence, blood pressure control, and stress reduction remain lifelong priorities. There's a fear myth that people with heart conditions shouldn't be sexually active or exercise at all, when in reality, with proper medical clearance, most can safely return to sexual activity and recreational physical activity, and should avoid inactivity, which itself increases risk. The belief that heart disease is only genetic and nothing can be done is also misleading, because while genetics play a role, modifiable risk factors like smoking cessation, weight control, diabetes management, and blood pressure reduction account for a significant portion of risk reduction. Many think that heart health requires expensive foods or programs, but cost-effective heart-healthy eating plans and accessible activities like walking or home-based movement routines are effective. Another myth is that avoiding all stress means no physical or mental challenge. A healthier approach involves resilience building and coping strategies rather than avoidance. People often think they can tell if their blood pressure or cholesterol is fine based on how they feel. But these are silent conditions that require regular measurement because they rarely cause symptoms until damage is advanced. There's a belief that painkillers like NSAIDs are harmless, but frequent use can increase blood pressure and strain the heart, particularly in people with existing conditions. Myths around pregnancy and the heart suggest women cannot exercise or manage blood pressure safely during pregnancy, but with proper supervision, many can maintain heart-healthy lifestyles. Misconceptions about salt substitutes, protein needs, hydration, and specific superfoods also abound and often oversimplify complex nutritional science. For example, potassium-rich fruits and vegetables support healthy blood pressure but should be managed carefully in those with kidney issues. Others assume that once heart disease develops, nothing helps. The truth is that evidence-based lifestyle changes can significantly slow progression, improve quality of life, and reduce hospitalization. Some claim that caffeine must be avoided entirely when moderate caffeine intake may actually be heart neutral or even beneficial for some individuals while being harmful in excess, so personalization matters. There's a myth that you need to exercise for hours daily to see benefit, when even 30 minutes of moderate activity most days confer strong cardiovascular protection. Some believe that heart disease always causes dramatic symptoms. Silent ischemia and arrhythmias can be symptom-free yet still dangerous. People often think that organic or natural labeled foods are automatically heart healthy, but added sugars, trans fats, and high sodium can still be present. Some believe that heart monitors and wearables eliminate the need for medical checkups when they are tools for awareness but not substitutes for professional evaluation. A pervasive myth says that once you start medication you'll depend on it forever. While many do require long-term therapy, some risk factor improvements with sustained lifestyle change allow safe adjustment under medical supervision. Others think that irregular heart rhythms are harmless if they don't hurt, but arrhythmias can lead to stroke or heart failure if not properly managed. There's a myth that only heavy smokers or very overweight people get heart disease, but moderate smokers and people with normal weight but unhealthy diets and low activity are also at risk. Some assume that more exercise always equals better health. Overtraining without appropriate rest increases inflammation and cardiac strain. Many think that high blood pressure symptoms are obvious, but hypertension is asymptomatic for years in many and regular measurement is essential. Others believe that antioxidants from pills replace whole food benefits. Whole foods provide synergy of nutrients that pills cannot mimic. A belief persists that stress tests detect all heart problems when some conditions require advanced imaging or evaluations. Some think that heart disease cannot be reversed, when evidence shows regression of plaque and risk with diet, exercise, and risk factor optimization. Another myth is that only Western diets are harmful when traditional diets can be high in sodium and fats without careful choices. Others assume that heart failure equals imminent death. Many live decades with well-managed heart failure. Some believe that skipping meals is harmless, but inconsistent eating can worsen blood sugar and lipid profiles. Many think that low-fat products are always best, but some low-fat foods are high in sugar and sodium. Others think that brown bread or brown rice automatically means healthy, but processing level and additives still matter. There's a myth that medications like statins cause heart damage when they actually stabilize plaque and reduce events when used appropriately. Some assume that routine check UPS aren't necessary if they feel well, when preventive care detects risk early. Others fear that all heart conditions require surgery when many are managed medically. There's a myth that cholesterol levels are the only risk factor. In fact, blood pressure, smoking status, diabetes, activity, diet, age, and family history together determine risk. Some think that weight loss alone fixes heart disease when fat distribution, muscle mass, and metabolic health are equally important. Others believe that certain ethnic diets are inherently healthier without considering modern changes and preparation methods. There's a misconception that people with implants or grafts should never exercise vigorously, when guided physical activity is often recommended. Some assume that medication side effects are worse than disease progression when unmanaged disease has far higher risk. Others think that high HDL always protects completely, when functionality of HDL matters. Some believe that routine cholesterol numbers tell the entire story when inflammation markers and advanced profiles are also important. And many people assume that mild symptoms don't require attention when early intervention consistently improves outcomes. By addressing each of these myths around heart health, diet, exercise, symptoms, medications, monitoring, lifestyle, and risk factors, listeners can realize that heart care is nuanced, evidence-based, and personalized, and that separating fact from fiction empowers them to protect their hearts effectively and live stronger, healthier lives.